Assalamu alaikum. As been demonstrated in a systematic review and meta-analysis by Yang Dinag 2016, where he stated that the diode and Nd:YAG laser penetrate deep into the biological tissue and have a significant scattering capacity and offering great decontamination and hemostatic effect. And up to date, there is no histological study assess the histological response of the human dental pulp to low-level laser therapy with the direct pulp capping procedures. Therefore, the aim of this study was to evaluate the histological response of the human dental pulp using MTA as a direct pulp capping agent, with or without low-level laser therapy. It's a split-mouth randomized control trial published in Australian Endodontic Journal 2025 by Indian group, which was conducted on 16 patients aged between 15 and 25 years old who have at least two premolars, either maxillary or mandibular, with closed apices that are scheduled for extraction with no systemic disease or pulpal or preapical pathosis. Each patient received both treatment of direct pulp capping, with one side received MTA alone and the other side received MTA with low-level laser therapy. All teeth were assessed the vitality using the EBT and radiographically preoperatively, and the teeth were prepped until the pulp exposure was created and hemostasis was achieved with saline dipped in the cotton pellet for the control group and using of 980 nanometer of diode laser for the experimental group. And the MTA was then placed, followed by RESA-modified glass ionomer and composite restoration. All the procedures were performed by one endodontist, and the teeth were extracted after 6 weeks for histological analysis. The slides were stained with H&E and evaluated by two blinded pathologists, and the histological assessment criteria include 4 criteria of morphology and continuity of the dentine bridge, thickness of the dentine bridge, inflammatory cell response, and pulp tissue organization that are scored from 1 to 4. The result demonstrated that the experimental group with MTA with low-level laser therapy demonstrated higher incidence of complete dentine bridge with 87% compared to the control group of 68%, with also a thicker bridge of larger than 0.25 mm of 81% and 68% in the control group. However, these differences were not statistically significant. And inflammation was significantly lower in the low-level laser therapy group, with all sample showed a mild inflammation of 100% compared to the control group, which has 68% mild and 31% have moderate inflammations. And normal and or almost normal tissue morphology were observed in both group of 87% of experimental group and 68% of the control group, with none of the group demonstrated a score 3. And also the differences in the pulp tissue organization were not statistically significant. So, as a conclusion of this study, adding a low-level laser therapy to MTA for direct pulp capping procedures reduce significantly the pulp inflammations and could promote more uniform and thicker dentine morphology, indicating that could improve the pulpal tissue healing. Although this study used a split mouth design, which reduced inter-individual variability and increase the internal validity, and also evaluate the human histological response. However, this study have some limitation, including the low sample size of only 16 patients who only monitor for 6 weeks with no long-term clinical assessment, and those included patients were underwent to a mechanical exposure rather than caries exposure, and also involve only patient between 15 and 25 years old, which limit the generalizability of the populations. And thank you.